Welcome to the project overview for the Highway Project, an implementation project funded by PCORI to implement advanced care planning for patients on dialysis. The primary investigators for this project are Drs. Dale Lupu and Mark Unruh. We know that patients on dialysis have a high morbidity rate, and it's even higher for those patients with comorbidities. However, kidney patients are not having the discussions with their healthcare providers about their goals and hopes for end of life care. We know in a lot of cases, patients want their providers to know these wishes, but one of the reasons that they may not know is that physicians don't often feel adequately prepared to shift from discussions of treatment to those of end of life. However, we know that social workers and case managers do have unique training that prepares them for these types of difficult conversations. This is what the Highway Project aims to do. Highway stands for Honoring Individual Goals and Hopes for Implementing Advanced Care Planning for Patients on Dialysis. This project is funded by the Patient Centered Outcomes Research Institute, or PCORI, which is a nonprofit, non-governmental agency. Additionally, this project is supported through the Coalition for Supportive Care of Kidney Patients, which is housed within the School of Nursing at George Washington University. This project is based off a previous study called the SDM-RSC, or Shared Decision Making Renal Supportive Care. This previous study focused on training social workers and nephrologists in having advanced care planning conversations with their dialysis patients. These meetings were held all together and multidisciplinary. They found that the SDM-RSC was effective in eliciting the goals of patients on dialysis. The Highway Project builds on the previous study. We have updated the training to be up to date with new knowledge we've learned about advanced care planning in dialysis patients. We are looking to implement this project in more dialysis centers nationwide and in large dialysis organizations to plan for long-term scale-up plans. The first study also used an Apple operating system to provide resources on ACP. This project has revamped that application to be available on all operating systems, as well as a web-based application that can be accessed through a desktop. This application helps to guide a provider through the advanced care planning process. Furthermore, we found that short conversations led by the social worker are more feasible for the dialysis patient than a scheduled meeting to plan ACP. So, our training focuses on how to incorporate advanced care planning into the current workflow of social workers and case managers. Once we've enrolled our participants into a cohort, they will attend 3 sessions of 2 hours each, led by leading experts in the field of social work and advanced care planning. Once training has completed, we will work with the social workers or case managers to integrate advanced care planning into their current workflow, utilizing the app and the other resources we provide. We are not looking to reinvent the wheel, but show that it is doable to elevate what a social worker is currently doing in their dialysis centers to include advanced care planning in those conversations. Additionally, we are providing ongoing support for approximately 9 months after the completion of the training. This ongoing support includes monthly webinars, check ins, collaboration, and with the other participating social workers and caseworkers, as well as one on one mentorship with an expert social worker. We plan to enroll 3 cohorts of social workers or case managers, staggered to allow for smaller training groups and more personalized mentorship and collaboration. Each cohort should have 15 to 20 social workers or case managers. After the training finishes, the social worker will enter the action period to implement advanced care planning into their workflow. The project team will check in with these social workers and case managers for the next 9 months and work with our participants to complete the evaluation in the final month. Overall, from training, action period, and evaluation timeframes, a social worker or case manager will be involved for approximately 1 year with the project team. The curriculum for the training has been adapted from the original SDM-RSC project. It will be held online using a web conferencing system rather than being in an all-day seminar. Best practices for online adult learning are utilized throughout the training to allow for interactive learning. Key topics will cover advanced care planning, motivational interviewing, empathy, cultural competency, integration into current workflow, how to resolve conflict, leadership, and communication. So, what are the next steps if you are interested in this project? If you are a social worker or a case manager, apply for the project and wait for the first training session. If you are a physician working in one of the dialysis centers, it is vital for you to help support the social worker and to be informed on the project by reviewing the training modules and discussing with your social worker how to best support their conversations with your patients in the center. Other team members in the dialysis center can also support the social worker in these conversations. If you have any questions, please email the project team, and we look forward to supporting your patients through this project.